All right, today we're jumping into a topic that's incredibly important, right from the very first moments of life: congenital heart disease. Now, I know that sounds pretty complex, but trust me, over the next few minutes, we're going to break it all down and make it super clear.
So, what exactly is it? At its core, congenital heart disease is any kind of structural problem with the heart that a baby is born with. And that's the key thing to remember. This isn't something that develops later on, it's there right from the start. And that really is the big question, right? It's one thing to have a definition, but what does a structural defect actually mean for newborn? How does it affect them? Well, it turns out this question leads us down two very different paths.
Okay, so doctors basically group these conditions into two main buckets: acyanotic and cyanotic. But a much easier way to think about it is pink baby versus blue baby. And it really all boils down to one thing: oxygen. With acyanotic conditions, the baby's getting enough oxygen-rich blood so their skin stays nice and pink. But with cyanotic conditions, oxygen-poor blood gets pumped around the body, and that's what can cause that characteristic bluish tint. All right, let's head down that first pass. We're going to start with the acyanotic conditions, the pink baby side of things. Here, the main problem isn't a lack of oxygen, but more about where all that oxygenated blood is actually going. Yeah, so the most common issue here is something called a left to right shunt. All that really means is there's an abnormal opening somewhere in the heart. This opening causes oxygen-rich blood from the left side to flow back over to the right side, where it doesn't belong. This could be a hole between the upper chambers, that's an ASD or atrial septal defect, or between the lower chambers, which is a VSD or ventricular septal defect. Either way, this mix-up makes the heart and lungs have to work way harder than they should.
So, if you're a parent, what might you actually notice? Well, because the heart is working in overdrive, the baby might get really tired during feeding. They might struggle to gain weight. You might also see them breathing really fast, and all that extra blood flow going to the lungs can unfortunately lead to more chest infections. These are those subtle but super important clues. Okay, now let's switch gears and walk down that second path. If the first path was all about the heart working too hard, this one is about a fundamental lack of oxygen. We're now in the world of cyanotic conditions, where that blue baby appearance tells us a completely different story about how the blood is flowing. And when you talk about cyanotic heart disease, there's one condition that's the most common of them all: tetralogy of Fallot, or just TOF for short. I know, the name sounds like a mouthful, but tetralogy just means it's a combo of four different things. And you can see just how complex this is. TOF is actually four problems all happening at once. You've got a hole between the ventricles, that VSD we mentioned earlier. The aorta, the body's main artery, is in the wrong position. The right ventricle muscle gets really thick from working too hard. And finally, the pathway to the lungs is too narrow. It's this specific combination that causes that oxygen-poor blood to get sent out to the body. The signs here can be a lot more obvious. Of course, there's the cyanosis, that bluish color to the skin. Over time, you might also notice a clubbing shape to the fingers and toes. And here's something really fascinating. Toddlers with TOF will often instinctively squat down. It might look strange, but they're actually doing it because that position helps push more blood to their lungs and temporarily boost their oxygen levels. It's pretty amazing. Okay, so with all these different conditions and symptoms, how in the world did doctors figure out exactly what's going on inside such a tiny little heart? Well, that brings us to the whole diagnostic process. Doctors have a whole range of tools they can use. It usually starts with a simple clinical exam, just listening to the heart for any unusual sounds, which are called murmurs. A chest x-ray can show the heart's size and shape. In fact, some conditions have a classic look, like the famous boot-shaped heart you see with TOF. An ECG checks the heart's electrical activity. And then you have simple, painless tests like pulse oximetry to measure oxygen levels right through the skin. But out of all those tools, there is one that is considered the absolute gold standard, and that's the echocardiogram, or echo. Think of it like an ultrasound for the heart. It gives doctors this incredible, real-time, moving picture of the heart's structure, the valves, and exactly how the blood is flowing. It is, without a doubt, the definitive tool for getting a diagnosis. So, once the doctors have that clear picture from the echo, what happens next? This is where the story gets really hopeful. The treatments and management for these conditions have come such a long way. So let's take a look at how medical teams map out a plan for these kids. The key thing to know is that there's no one-size-fits-all treatment. It's totally specific to the type of defect. For example, a really small VSD, that hole between the ventricles, might just be watched closely because a lot of them actually close up all on their own. Something like a PDA might be closed with medication or a tiny little device. But for the really complex stuff like TOF, the final fix is surgery. Although parents are also taught things like the knee-chest position to help manage those low oxygen spells before the operation. Now, beyond all the high-tech medical stuff, the day-to-day care from parents and caregivers is just absolutely essential. Their observations, their actions, they are a huge, vital part of the child's overall care plan. And this is a fantastic guide for what to keep an eye on at home. It's all about being vigilant. Watching for any changes in skin color, noticing if breathing becomes difficult, keeping track of feeding habits and growth on the chart. Sometimes you might even be asked to monitor oxygen levels at home with a small device. This constant, careful observation is so important. And on top of that, there are some really practical things caregivers can do to help. Just propping the baby up a little bit can make breathing easier. Giving smaller, more frequent feeds means they don't have to use as much energy all at once. And of course, because these kids can be more vulnerable, being super strict about infection control is a must. It's all about creating a safe, supportive environment that puts less strain on their little heart. So what's the big takeaway from all of this? Look, a diagnosis of congenital heart disease is, without a doubt, a scary thing for any family to face. But it is not the end of the story. The absolute key to a positive outcome is that powerful combination of early detection and dedicated, loving care from both the medical team and the family. In the end, being informed and being vigilant, that's what makes all the difference in the world.